President Obama is getting hit from all sides. It's not just states battling the national health care law. Republican Senator Lindsey just signed something he calls a citizen's prescription. Now, what's that all about? Senator Graham joins us live. That's not the only news you have about health care, so let us have it. What is your news about health care?
Well, what I want to do is allow people to have a say about health care. This bill was passed behind closed doors. It was a real sleazy process. They bought off senators to get to 60 votes. I've got an idea with Senator Brasso from Wyoming.
Who's a doctor?
Who's a doctor. Basically, the citizen's prescription is you can sign at lgram.senate.gov, lgram.senate.gov. You can sign a petition asking for the ability of your state to opt out. We're doing this all over South Carolina, and we want to allow the states to have a say as to whether or not the individual mandate, the employer mandate, and Medicaid expansion should happen in your state. So you would finally get to speak, not the politicians, and we're going to introduce legislation next year to allow every state to opt out if they choose in those three areas.
Isn't it too late for that?
No, it's never too late. This bill is just getting started. They promised it would lower premiums. That's why we passed it, right? It would lower health care costs. Guess what? Premiums are going up by 8.8% next year. So everything around this bill has been a fraud, quite frankly. You're attacking it in court, but I would love to have the American people have a say about whether or not they want to be in the individual mandate, the employer mandate, or have Medicaid expand. In my state, it would cost South Carolina $1 billion in the next 7 years to add the Medicaid enrollees envisioned by this bill. 29% of South Carolina will be on Medicaid if this bill becomes law. I would love the ability of my state to opt out if she chooses.
What are the Democratic members of the Senate, if they talk to you, or at the House, what do they say to you in light of the, sort of the reaction of the American people, a lot of the American people, or even the rise in premiums? We're reading stories about premiums.
You believe in the marketplace, don't you? Don't you believe in competition? How many years have you dominated the 10 o'clock hour?
8.5 years. I think it's 101 straight months. Okay. Not that I'm counting.
Well, let me tell you, the marketplace determines the value you have at 10 o'clock. The reason no Democrat is running around this bill, trying to sell this bill. How many ads have you seen by Democrats who say, I voted for the Obama health care bill and I'm proud of it?
But I know it's zero, but don't even pull
it's zero.
But don't even pull you aside and say, boy, it didn't look like that. Or,
absolutely.
They say that to you?
The special deal says it all. The deal for Louisiana. She knew it was bad for Louisiana. She got a special deal. The Cornhusker kickback, the deal for Florida. Certain senators understood it was bad for their states, so they carved out special deals. What I want to do is give everybody in the country a chance to get a deal for their state. Opt out of this thing before it's too late. In 2014, it's too late. We've got plenty of time. If Congress will allow the people to speak, I am confident in America, most states will opt out of this health care bill.
Do you ever hear from the White House about health care? Are they silent about it?
I mean, this has been a lemon. The reason no one is talking about why they voted for the bill and they're running away from the bill is because it doesn't pass the smell test. It didn't do what it promised. It's been a fraud from the beginning. The way it was passed says all you need to know about the substance. If it was that good a bill, why couldn't you get one Republican? Why'd you have to do it behind closed doors?
Well, even worse than that, all the ones that voted for it, why aren't they bragging about it? I mean, like you brag,
the marketplace tells you the value of this bill.
But it's like, and it's a horrible political thing, but it's terrible that.
It's terrible for our economy. It's terrible for health care.
I mean, if no one is willing to support it and no politician is willing to run on it, we ought to have the courage to take another look at it.
Well, what we ought to do is allow states, the individual states, to say, do I want to be part of this when it comes to the individual mandate, the employer mandate, and the Medicaid expansion?
But if you're out of the individual mandate, you don't sort of lower the. I mean, we need everybody to be in the pool. That's the whole thing of the Democrats on it.
What we need is a chance to speak about this.
That's something different. I'm something different. But if you opt out, you're going to create a lot of resistance because if you opt out.
There's plenty of way to assure Americans without 80% of Americans being in government-run health care. My view is that I want more people to be covered than are covered today, but less of them be covered by the government, more people covered by the private sector.
I still want to do a multiple choice guess for the members of the House and Senate who voted for it to see if they know what's in it.
Well, the reason they're not talking about what's in it.
They don't know what's in it.
Well, no, they know what's in it and it's not selling. The reason they're not trying to sell it is because people are not buying it.
I think that they're afraid to look at it because every time you pull another page, read another page, you read another bad debt. Think
well,
about
it didn't. It didn't. It's not deficit neutral. It's added to the debt. Premiums are not. We're supposed to go down by $2,000 per person. 8.8% increase. So this lindseygraham.senate.gov gives you a chance to sign a petition that I will take to the Congress, and we have a comment section. Tell me why you're signing the petition. I will go to the floor of the Senate and read your comments and try to get my colleagues to give you a chance to vote on this bill.
Senator, thank you, sir.
Thank you.
Next, Joy.